Nearly 250,000 Australians have checked whether they are eligible for the next phase of the COVID-19 vaccine rollout. The federal government yesterday announced that people in phase 1B could get their vaccine from next week, and they should book an appointment to see a GP. It led to doctors' surgeries being inundated with calls from people asking to get their first dose. Political reporter Stephanie Boris joins us now from Parliament House in Canberra. Steph, g'day. So Federal Health Minister Greg Hunt has defended how yesterday played out with his booking process. Many people contacted the ABC describing the process as a shambles. How has the Minister described the plan for the vaccination of those in phase 1B?
Well, Greg Hunt is standing by the rollout of the phase 1B vaccination plan yesterday, announcing that people could go online, check their eligibility and then get in touch with a local GP clinic in order to book an appointment to get their vaccination. Now, he doesn't agree with what we've been hearing from a number of GPs and a number of ABC listeners and viewers, and the message we were getting from people out in the public was that the rollout was actually quite confusing. A lot of GPs weren't aware that the announcement was being made yesterday. They didn't have the booking systems ready to go, despite that announcement being made. Obviously, there is a huge demand for people to get vaccinated. Greg Hunt saying that that's a positive element of what we saw occur yesterday. He was insisting that this is a marathon, it's not a sprint. However, GPs have expressed their anger towards the ABC in terms of telling us that, you know, they knew that this was coming, but they didn't quite know when. Greg Hunt spoke to AM this morning where he outlined that there was nearly 250,000 people that did go online yesterday to check their eligibility. And from next week, we do know that there's 1,000 GP clinics that will be offering this vaccine. Greg Hunt today as well explaining that aside from those GP clinics, there will be what we're calling Commonwealth clinics. So if you can't get into your local GP or a GP clinic isn't taking you, there are other options available.
Well, with great respect, I disagree on both fronts. In fact, Brendan Murphy announced on Sunday with the Prime Minister that the information would be released this week, and that's because next week we move to what's known as phase 1B of the over 80s and the over 70s. And so as we have more vaccines come online, we're expanding to the general practices. Every general practice that was included yesterday had indeed placed its orders. So I think what we're seeing is 1,069 practices that were announced yesterday. Today, we're announcing over 100 Commonwealth vaccination clinics that will take all comers, and with over 100 around the country, that's a very important addition, and they'll have, on average, close to 1,000 vaccines a week. And so that expands the capacity very significantly.
Do clinics deserve an apology here because they say that they were completely inundated?
I think they deserve our thanks. That on day one, there was always going to be an initial surge and initial demand. And every clinic that was listed had actually placed their orders. And so I want to thank them for that.
Health Minister Greg Hunt speaking there to Sabra Lane on ABC Radio's AM program just in the last hour or so. So, Steph, what advice are GPs giving patients if they're in this phase 1B group, which includes people over the age of 70 and other people too?
The key word in this process, Joe, is patience. There are 6 million people in phase 1B, and it is going to take quite some time to get through everyone. We have been told that these GP clinics that are able to give the doses from next week, so that's about 1,000 GP clinics, they're only going to be getting around 50 to 100 doses a week to start with. Obviously, that will ramp up over time, but that gives you a bit of an indication as to how small the initial rollout of phase 1B will be from Monday next week. We have heard from the AMA today. They said that by all means you can call a GP clinic that's on that list, but the likelihood of you getting in next week is pretty limited. Maybe call back in another week or two.
We need an orderly type process, and getting away from the announcement yesterday. That'd be my message to everybody out there. For everybody, just to hold their horses a little bit, and just get with the idea that the vaccines will be there, but they just need to be done in a calm, orderly way. Which is, the best bit is in Australia, unlike overseas, we don't have much COVID, so we're going to be able to do this without COVID pushing us.
And Steph, just before we move on to the next subject, that was the AMA boss there. Was he kind of diplomatic with how he was describing what happened yesterday? You mentioned that we've had doctors who've been pretty frustrated at how it was handled. What's the official line from the AMA on it?
Well, the official line, as we were hearing there, Joe, was that GPs are ready to go, but they were a little bit taken by surprise. I've spoken personally to a number of these GP clinics that are on that 1,000 list, and the message that I've got on the phone is that they're not happy because while, yes, they did apply to be on this vaccination list and they were aware that this was going to be happening, they didn't know it was happening yesterday. And so therefore, a number of receptionists were just receiving, hundreds of phone calls yesterday, and they weren't aware it was happening. There was one particular clinic that said they didn't have the booking system up in place. Other clinics were saying they're actually worried about whether they get the vaccine in time for Monday because they haven't even been told about when the vaccines will be delivered to these GP practices.